patient's chief complaints always has to be recorded with the patient's own statement.
Tent like structure made of nickel and titanium alloy, what we call an occluder, is positioned across the defect guided by fluoroscopy.
If you try to open this way, when the gown comes out, there are chances of the gown brushing your hand.
वे कह सकते हैं कि कोई उन्हें निर्देश दे रहा है, कोई उनके कानों में बात कर रहा है, जो वास्तव में वहां नहीं हो सकता। तो ये सभी भ्रांतियां हैं जिनके बारे में वे कहने की कोशिश करते हैं।
Any damaged, incomplete or malfunctioning instrument must be reported to the supervisor and it has to be documented in the appropriate logbook.
எப்போதும் 94% மேற்பட்ட ஓய்வு நிலையை இலக்காக கொள்ளுங்கள் மற்றும் அனைத்து நோயாளிகளுக்கும் 100% இலக்காக கொள்ள வேண்டாம்.
The blood and blood component bag should be checked for any sign of hemolysis in the plasma, which may happen due to overwarming or freezing of bag
at the level of the symphysis pubis. That is, it is 12 weeks. At the level of the umbilicus, it is 24 weeks.
అంతేకాక హైపోగ్లైసిమియా ఎదుర్కొనడానికి సరిపడా 25% డెక్స్ట్రోస్ బాటిళ్లను అందుబాటులో ఉంచాలి.
She is pressing her hand against the baby. Similarly, the other hand against the other baby. You have to ensure that the neck support is there for both the babies.
ಇದು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಿಂದ ನಿರ್ಮಿತವಾದ ಜೆಜುನೋಸ್ಟಮಿ ಎಂಬ ತೆರೆಯುವಿಕೆಯ ಮೂಲಕ ಸಣ್ಣ ಅಂತರದಲ್ಲಿ ನೇರವಾಗಿ ಪೋಷಕಾಂಶಗಳನ್ನು ಒದಗಿಸುವ ವಿಧಾನವಾಗಿದೆ.
প্রতিটি পরবর্তী বিটের সাথে ইন্টারভালের ক্রমাগত দীর্ঘায়ন হয় যতক্ষণ না একটি ওয়েভ পরিচালিত হয় না, অর্থাৎ একটি বিট মিস হয়ে যায়।
While loading a suture on the needle holder, avoid taking the needle out of the pack to load it on the needle holder. Instead, you can directly use the needle holder to load the needle and then pull out the suture. This way, the tip will not damage your gloves.
And there are times when people can have what is called partial seizures, where only part of their body is involved and moves.
ഒന്ന്, സാങ്കേതികമായി മരുന്നുകൾ നൽകുന്നതിലൂടെ ഇത് കുറയ്ക്കുന്നതാണ്. ഔഷധമില്ലാത്ത രീതികൾ ഉപയോഗിച്ച് രോഗിയെ ശരിയായ നിലയിൽ ഇരുത്തുക, ഭക്ഷണം കുറയ്ക്കുക.
You have to place one over the apex and one over the sternum, and you have to deliver the shock by using these red color buttons.
Webinar participants, we have a few announcements for your attention. Please make sure you mark your attendance to get your certificates by filling the form posted on chat. Second, post questions in the chat box for the panelists. Add your name and email ID to the question.
Patient's chief complaints always has to be recorded with the patient's own statement.
Tent like structure made of nickel and titanium alloy, what we call an occluder, is positioned across the defect guided by fluoroscopy.
If you try to open this way, when the gown comes out, there are chances of the gown brushing your hand.
वे कह सकते हैं कि कोई उन्हें निर्देश दे रहा है, कोई उनके कानों में बात कर रहा है, जो वास्तव में वहां नहीं हो सकता। तो ये सभी भ्रांतियां हैं जिनके बारे में वे कहने की कोशिश करते हैं।
Any damaged, incomplete or malfunctioning instrument must be reported to the supervisor and it has to be documented in the appropriate logbook.
எப்போதும் 94% மேற்பட்ட ஓய்வு நிலையை இலக்காக கொள்ளுங்கள் மற்றும் அனைத்து நோயாளிகளுக்கும் 100% இலக்காக கொள்ள வேண்டாம்.
The blood and blood component bag should be checked for any sign of hemolysis in the plasma, which may happen due to overwarming or freezing of bag
at the level of the symphysis pubis. that is, it is 12 weeks. At the level of the umbilicus, it is 24 weeks.
అంతేకాక హైపోగ్లైసిమియా ఎదుర్కొనడానికి సరిపడా 25% డెక్స్ట్రోస్ బాటిళ్లను అందుబాటులో ఉంచాలి.
She is pressing her hand against the baby. Similarly, the other hand against the other baby. You have to ensure that the neck support is there for both the babies.
ಇದು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಿಂದ ನಿರ್ಮಿತವಾದ ಜೆಜುನೋಸ್ಟಮಿ ಎಂಬ ತೆರೆಯುವಿಕೆಯ ಮೂಲಕ ಸಣ್ಣ ಅಂತರದಲ್ಲಿ ನೇರವಾಗಿ ಪೋಷಕಾಂಶಗಳನ್ನು ಒದಗಿಸುವ ವಿಧಾನವಾಗಿದೆ.
প্রতিটি পরবর্তী বিটের সাথে ইন্টারভালের ক্রমাগত দীর্ঘায়ন হয় যতক্ষণ না একটি ওয়েভ পরিচালিত হয় না, অর্থাৎ একটি বিট মিস হয়ে যায়।
While loading a suture on the needle holder, avoid taking the needle out of the pack to load it on the needle holder. Instead, you can directly use the needle holder to load the needle and then pull out the suture. This way, the tip will not damage your gloves.
And there are times when people can have what is called partial seizures, where only part of their body is involved and moves.
ഒന്ന്, സാങ്കേതികമായി മരുന്നുകൾ നൽകുന്നതിലൂടെ ഇത് കുറയ്ക്കുന്നതാണ്. ഔഷധമില്ലാത്ത രീതികൾ ഉപയോഗിച്ച് രോഗിയെ ശരിയായ നിലയിൽ ഇരുത്തുക, ഭക്ഷണം കുറയ്ക്കുക.
You have to place one over the apex and one over the sternum, and you have to deliver the shock by using this red color buttons.
Webinar participants, we have a few announcements for your attention. Please make sure you mark your attendance to get your certificates by
patient's chief complaints always has to be recorded with the patient's own statement.
Tent like structure made of nickel and titanium alloy, what we call an occluder, is positioned across the defect guided by fluoroscopy.
If you try to open this way, when the gown comes out, there are chances of the gown brushing your hand.
वे कह सकते हैं कि कोई उन्हें निर्देश दे रहा है, कोई उनके कानों में बात कर रहा है, जो वास्तव में वहां नहीं हो सकता। तो ये सभी भ्रांतियां हैं जिनके बारे में वे कहने की कोशिश करते हैं।
Any damaged, incomplete or malfunctioning instrument must be reported to the supervisor and it has to be documented in the appropriate logbook.
எப்போதும் 94% மேற்பட்ட ஓய்வு நிலையை இலக்காக கொள்ளுங்கள் மற்றும் அனைத்து நோயாளிகளுக்கும் 100% இலக்காக கொள்ள வேண்டாம்.
The blood and blood component bag should be checked for any sign of hemolysis in the plasma, which may happen due to overwarming or freezing of bag.
At the level of the symphysis pubis, that is, it is 12 weeks. At the level of the umbilicus, it is 24 weeks.
అంతేకాక హైపోగ్లైసిమియా ఎదుర్కొనడానికి సరిపడా 25% డెక్స్ట్రోస్ బాటిళ్లను అందుబాటులో ఉంచాలి.
She is pressing her hand against the baby. Similarly, the other hand against the other baby. You have to ensure that the neck support is there for both the babies.
ಇದು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಿಂದ ನಿರ್ಮಿತವಾದ ಜೆಜುನೋಸ್ಟಮಿ ಎಂಬ ತೆರೆಯುವಿಕೆಯ ಮೂಲಕ ಸಣ್ಣ ಅಂತರದಲ್ಲಿ ನೇರವಾಗಿ ಪೋಷಕಾಂಶಗಳನ್ನು ಒದಗಿಸುವ ವಿಧಾನವಾಗಿದೆ.
প্রতিটি পরবর্তী বিটের সাথে ইন্টারভালের ক্রমাগত দীর্ঘায়ন হয় যতক্ষণ না একটি ওয়েভ পরিচালিত হয় না, অর্থাৎ একটি বিট মিস হয়ে যায়।
While loading a suture on the needle holder, avoid taking the needle out of the pack to load it on the needle holder. Instead, you can directly use the needle holder to load the needle and then pull out the suture. This way, the tip will not damage your gloves.
And there are times when people can have what is called partial seizures, where only part of their body is involved and moves.
ഒന്ന്, സാങ്കേതികമായി മരുന്നുകൾ നൽകുന്നതിലൂടെ ഇത് കുറയ്ക്കുന്നതാണ്. ഔഷധമില്ലാത്ത രീതികൾ ഉപയോഗിച്ച് രോഗിയെ ശരിയായ നിലയിൽ ഇരുത്തുക, ഭക്ഷണം കുറയ്ക്കുക.
You have to place one over the apex and one over the sternum, and you have to deliver the shock by using these red color buttons.
Webinar participants, we have a few announcements for your attention. Please make sure you mark your attendance to get your certificates by filling the form posted on chat. Second, post questions in the chat box for the panelists. Add your name and email ID to the question.
The patient's chief complaints always has to be recorded with the patient's own statement.
Tent like structure made of nickel and
All the best to all of us.
All the best.
Going ahead. Going ahead. Good afternoon, everyone. I am Dr. Sharda Ramesh, a nursing professional, academician, administrator with over 40 years of experience in nursing leadership. And I am the moderator for today's webinar, Smart Ward, Addressing the Knowledge and Skill Gaps, organized in celebration of Perioperative Nurses Week. I would like to begin by extending my appreciation and gratitude to Hxplain digital learning platform for arranging this timely event. We are currently experiencing dynamic changes in the healthcare industry. Operating rooms are changing at a very fast pace. We are now witnessing new developments with very advanced procedures, new medical devices, technologies, and quality standards driving changes in all our processes. All these changes makes the discussion particularly relevant in today's context. To discuss on these developments, we have with us an esteemed panel of experts representing the academia, practicing ward nursing professionals, hospital nurse administrators, quality standard specialists, and a representative from the Premier Central Institute. I am confident that their insights will significantly benefit all the participants out here. We explore the latest developments, opportunities, challenges, and our preparation for the evolving healthcare industry. I also wish to express my appreciation to the numerous participants who have registered individually and as institutions. I am given to understand that we have over 2,000 unique registrations and combined participation of more than 40,758 viewers for the today's webinar. And your strong interest and eagerness to learn are highly encouraging for the future of our professional development. Let me now start the webinar. I welcome all the 6 panelists over to the webinar, and thank you for coming over to the webinar. Before we get into the deliberations, I would like to inform the audience that Mr. Prem Kumar, the liver transplant specialist of Rela Hospital, has expressed his apologies for not being able to join us live in this webinar due to an emergency professional commitment. He had to go to Dubai along with Dr. Rela to perform a liver transplant in Dubai. While we will miss him, it is also a proud moment to see Indian nurses being invited to perform transplant procedures outside our country. And though he is very young, he is dynamic. Mr. Prem Kumar has, however, shared a message which I would like to play to the audience. Can we have the recording of Mr. Prem Kumar, please?
Morning, everyone. I'm sorry to say this. I just came for the Dubai one emergency transplant. Anyway, I will just put a videos what you asked for the questions in the website. The first questions: over facing every challenges of the technical side of the surgery and the transplant. As a scrub nurse, when you come to in the theater or in transplant, the first thing you have to be thorough about the anatomy, thorough about the instrumentations, thorough about the SOP, what they will be following in theaters. But why we need to be follow all those things means, especially in the transplant, it's a long surgery. That's the main problem what their juniors nurses will be facing, and they can be a stand for the long time, and it's a complex surgery. So there is too many anatomy or too many organs will be involved. So when you push them for the transplant, they will have difficult to assist, difficult to find out what's the next step. And the other thing is, the most of the liver transplant will be in more HPV, hepatitis virus positive. And for that, the juniors will get panic. Sometimes they will have the needle stick injuries. So for these all the things they needs to be faced, because the surgeons will shout because they are not also used to doing a liver transplant. So in some centers they will do every day, some centers they will do once in a while. So for the case, the nurses also been on and off they're going. So it will be difficult for them to also what will be the next and what will be the surgeons techniques, what they will be expecting to identify. So for that, what the solutions? So first things, when they come to the junior nurse or the senior nurse into the theater in a transplant, for the transplant, first things, we need to train them how to assist for the surgeries. So for that, they need to be thorough about the anatomy, the surgical anatomy of the liver, how the liver looks, what are the vessels it comes, and what are the vessels they will divide, and what they will be anastomosing. So these needs to be thorough about the scrub nurse. If you be doing thorough about that, then you will be anticipating one step before the surgeons. Then you will be able to assess better. Then the second thing is, we will be using, then how do you see the surgical technologies? Now the technology will be changing, because it will be open to the robotic or open to the laparoscopic. In the many centers, they will move to the robotic. When you will be moved to the robotic, it's really challenging for the scrub nurse, because there are some centers they don't have the assistant surgeons in the bedside. The scrub nurse has to alone manage the suctioning, have to do the ligature, or sometimes they will do the all the bedside works. For that, you need to be really thorough about the liver anatomy and the surrounding structures. For that, why we need to be how you need to handle the diagnostic equipment. like the CUSA. CUSA means the cavitation ultrasonic aspirations, which will be using for to cut the liver. That will help. That works in three mechanisms like aspirations, coagulations, as well as it will cut the liver also. And the other machines which we will be using for is the APC, organ plasma coagulations. This is like just you have to spray on the liver cut surface. So that's to control the bleeding. The other thing is the cell saver and the the organ preservation machines. Sometimes they will they were going for the cadaveric. If it takes long time, they will put it into the machines like how the heart and pump machines will work. The same way the machines also will does. They will put it into the vein. The two cannulas, they will put it into the vein, and it will go circulating through that cold solutions through the liver, so it will preserve the liver tissues better than the other just storing into the ice box. So these are the things which we'll be using into the advanced technology. So when you come to the challenges in the transplant, the coordinations behind the coordination between the surgical and the anesthesia team is the very, very important. And the preparations will start then if you the preparations itself, it will take hard to prepare the trolleys or to prepare the patients, all those things. And the street so you have to maintain the street aseptic techniques, because the small mistakes you makes, the patients will go the worst things. Even for the catheterizations, you have to make the very sterile procedures, and these are the things we needs to be addressed. Thank you.
Dynamic young war nurse who is with us here, Mr. Bipin Girirlal Mishra from Ahmedabad. I have the pleasure of introducing Mr. Girirlal Bipin, a liver transplant specialist, and he is also having a lot of experience in Shalbai Hospital in Gujarat. Bipin, can I ask you a few questions? Given your experience in transplant surgeries, how rapid is the evolution of surgical technology and automation transforming workflows in the safety protocols? How are nurses adapting to ensure precision, efficiency, and patient safety? Can you please throw lights on those areas? Over to you, Bipin. You're unmuted, I guess. I mean, you have to unmute yourself, please.
Yeah, thank you, madam. And I am thanking to the Hxplain team to invite me for this very crucial and very essential discussion. As madam said, it is a it's a very needy and very required things for the nurses to cope up with the times and the changes and the evolutions in the healthcare sectors. So as madam said, in transplant, there are many automation and many changes there we had seen in last 1 decade. As you said, I'm giving one example is there. Previously, what we are doing, if there is a one liver transplant, so we require at least 50-60 blood products at a time in single liver transplant. But as you know, or as you aware with that, the thromboelastometry machines, so it has reduced the blood products and wastage of blood product also. So due to this thromboelastometry machine, the wastage of blood product and the requirement of the blood products we have decreased. And nowadays we are using only 10 to 12 blood products in a single liver transplant. So as per my view, this is a very big revolutionary automation and changes in the transplant surgery. And another thing is, in last decade, whatever we face, the cardiac output monitoring system is also introduced by some companies, and the cardiac output systems are also, you see, the real data of the cardiac system they are giving you at all the times. So that can also ensure a safety of patient. If we have, there is a blood loss, okay, or hypertension. So the cardiac output machine give you prior to 10 minutes before the alerts, you will be getting a hypotension or blood loss within a few times. So that we can cope up, and we can manage our plan and backup plan within this time period. So I would definitely say there are many automations and many changes and technology changes we've seen in the last 1 decade, and then this time.
How are you adapting, nurses? The technology is there, dynamic, but
Yes,
how
madam.
are you adapting to that? How do you train your people, or what is
Exactly.
the USB you're using in your hospital?
Exactly, madam. Exactly. Madam, prior to every transplant, we discuss with the team and we planning the accordingly. And regular basis, we are doing some simulation training also of the nurses. And sometimes we also open discussing every case we are planning differently, because of every case has a different requirement and different planning. So we are planning with the team prior to the case, and we are discussing through the nurses, and also we are discussing on what challenges and what problem they are found in the last case. So we are talking on that, and we try to that doubts clear. So this type of practices we are doing, and adopting the new things.
Thank you, Mr. Pippin, for giving
madam.
us an oversight on how it is being done and how automation has helped in reducing a lot of resources and manpower and material in any transplant surgery. Thank you for that.
Yes,
Now,
ma'am.
coming to, we have an experienced nursing administrator and a Florence Nightingale President Award winner, Ms. Dolly Biswas from Fortis Hospital, West Bengal. To start the conversation from as an administrator's point of view, Dolly, as someone managing clinical scenarios, how do you prepare your nurses to stay updated with these rapid changing technological changes, and also managing your clinical team? It's both the ends are very, very dynamic and fast. How do you prepare your nurses? And also, what are the biggest challenges you face frequently in the OR? Oh, can you please throw your light on this areas, Dolly? Over to you, Dolly.
Thank you very much, ma'am. First of all, I would like to congratulate for having this panel. The work behind this panel gone, for a long period of time. I would like to thank Hxplain, Mr. Gauri, ma'am, to you, and Ms. Bhavani, who has keep on connecting with all the panelists. Now, coming to your question, and thank you for the introduction. Ma'am, the workshop is, or the panel is based on perioperative nursing. Perioperative is the phase of pre, intra, and post-operative period. And every phases, nurses play great role. And every phases, nurses are facing many challenges. Coming to the preoperative preparations, if the communication is not effectively done with the family member regarding the scheduling of the surgery, regarding the reports which are required for the surgeon to view if patients are not been done before, that will be a great challenge for the nurse to organize the report and the file before sending the patient to operation theater. If a preoperative checklists are not being checked by the nurse, because nursing shortage, young nurses are coming out from the institutions not having an adequate knowledge, which as an administrator we are facing day and night. So preparing those new joinees, the new fresher nurses, is a big challenge. So in Fortis Hospital we are having our induction program called Virohan. Virohan means budding. With the help of the senior nurses, when the youngsters are getting trained, getting hand-holded, how to prepare a patient preoperatively before wheeling in to the PACU, and then from pre and post anesthetic area to the or pre-anesthetic area to the operation theater. So everything has to be proper. Now coming to the operation theater, the challenge of scheduling the surgeries, time management, then infection control practices. Once surgery is getting over, surgeon is in hurry. There is no time for the cleaning and disinfection. That's the big challenge we are facing. Surgeon is pushing, take the patient, take the patient. But as a senior OR nurse administrator or nursing in charge has to be firm. No, the time of disinfection and cleaning has to be given, so that after that only next patient to be taken. Challenge of the temperature monitoring, HEPA filter, whether it has been changed in an appropriate time. Otherwise, patient will get surgical site infection. Monitoring of temperature of the OR, monitoring of the humidity of OR is very, very important. Another biggest challenge that every time I think every OR nurses are facing, breakdown of the equipments. If appropriate AIMS is not done, if preventive maintenance is not done, especially if skillful hand is not utilizing the high-end equipments like laparoscopic equipments, lens. There are multiple, very fine scissors, the very fine needle holder, which is lakhs and lakhs rupees cost for a major like liver transplant, for kidney transplant, for open heart surgeries, for a pediatric cardiac surgeries. Very high-end equipments we are using. If that is not being used accurately, that is not being taken care, that is not being done proper regular maintenance, equipment breakdowns is a big challenge. Challenges with the shortage of our nurses that we are facing as a nurse administrator. How to manage, whenever we are asking to stretch the hours if surgeries are more, then maybe the staff will feel annoyed, but they are the nurse manager of OR or nurse administrator, play a great role, as well as the chief of nursing or a deputy chief of nursing, to be with them, to make them understand why you need to stretch. But when OR is light, at that time you have to give the time back so that they can take appropriate rest, and then they can resume their duty again. So these all, and training is very important. As Mr. Bipin said, that training with the simulator, training every day by arranging some of the other CNAs workshop, and them having a small OR course, 3 months, 6 months, specialized operation room course that will make the nurse strengthen with their knowledge and skill. Indian Nursing Council is having a very good specialized OR course, and that for the nurses we can adopt, we can train them, we can keep a specialized operation theater, specialized nursing educator who will take charge to train these nurses. And we have to connect with the surgeon. What is their requirement? What they want? How they want their nurse to assist them, to circulate them. So arranging by the surgeon also give an avenue to make them oriented with the specialized technologies. So
Thank
these
you,
are
ma'am. That was indeed a splendid overview of what is required and what are the challenges. The way you spoke itself, we can understand that daily you are wearing the shoes of challenge and sorting it out in your scenario. Thank you for the thought-provoking inputs that you have given to us. Now, our next panelist is an expert in drafting and implementing quality standards, protocols for the hospitals. I have the pleasure of introducing Dr. Harvinder Kaur, who is an expert, and we are all curious to understand as technology continues to advance. Madam, how do hospitals ensure quality and consistency in perioperative care? Do we have systems in place to support nurse preparedness and continuous training? You are an accreditation team itself. From your accreditation perspective, how do regulatory bodies uphold these standards, and where do you think there is still a scope for strengthening and betterment? Dr. Harvinder Kaur, recipient of Florence Nightingale Award. Madam, the floor is all yours.
Muted.
Madam, please unmute yourself, ma'am.
Yeah, I'm sorry I have muted myself because there should not be no voice when the others are speaking. That must be there now. So first of all, very good evening to all of you, to all the panelists, to all the students or the nurses who are with us in this platform. Really, it's a pleasure to meet you all, to talk to you all. It's a really pleasure of us. So it's a privilege. Really, it's a privilege for me to join you today as we come together to celebrate and reflect on one of the most vital that area, that is a perioperative nursing. So perioperative nursing, the person who are unsung heroes, really they are unsung heroes. Nobody knows what the work they are doing. So perioperative nurse, truly the heartbeat of the surgical team. And we are there all every critical, and they are, and we all nurses are there about every critical moment when the patient enters to the operating room, for the patient's safety, for their precision, for their compassion, and for everything. The nurses are there only, because myself also as a patient went to this operation theater journey also. So in a world of rapidly advanced technology and evolving the surgical technology, the role of continuous growth, we are not just supporting the procedures, but we are leading to the patient advocacy, that infection control practices. And nowadays, the tool like AI and the robotic surgery, that comes to this our world. Now we emphasize that our nurses should practice all these things. And as we begin today a discussion, let's remember that behind every success surgery stands a dedicated perioperative nurse, blending science, skill, and the empathy to make the healing possible. Now the question comes. This is dedicated to my all the perioperative nurses, whosoever in all over India and in the world, because perioperative nurses really, we salute to these nurses. So the question which you have put to me, that for the nurses preparedness and ongoing for the ongoing training in the perioperative nursing, that you have asked to me. So there are three areas where we can touch up. That perioperative nurses, as India has involved in tremendously being supported by the highly specialized skill, intensive care, and all those pre, intra, and post-operative. So there are structure, there should be, as Vipin also said and Dolly said, that there should be a structured induction program, as all the hospitals, and the hospitals which are NABH accredited and which are the NQAS accredited, they must have a structured induction program, and it is a required need of the hour also, that we should give to our nurses. What the Dolly Madam is giving their nurses in their Hotis hospital, and the Bipin is also, they are doing this in their hospital also. And we need in all hospital in the India, they must go for these kind of the structured induction program when the nurse enter in the in the operating room. And second thing is competency based. All we should have then SOPs and skill based checklists, so that we can more secure the patient. It is for the patient safety only. We should have a checklist before going for any procedure. This is written by NABH only, but all hospitals are NABH. Most of the hospitals are NABH accredited, and some of the government hospitals, they are NQAS accredited. So they must have a checklist before going for this quality. And third one is we should conduct the regular CMEs, as they both of the panelists which I have heard, they are doing it. So I request to all the hospital directors and management, they should conduct a regular CMEs regarding this, because unless and until they should conduct a CMEs or training for the safe operating practices, infection control, for doing all the equipments, they will not be able to give a patient safety. So these three are very important in my area. Thank you.
Thank you so much, ma'am. It was really thought-provoking, and we understand that there is a structure miss or miss gap in the structured way of teaching and learning for the novice nurses in the perioperative care. And as we move on, we will know what Hxplain is doing on that. So I don't want to do the promotion. It will be done
No,
by
it's
the
a
head of the
promotion.
project.
It's a very good thing.
Yes,
Doing
we
that.
are having multiple modules on that. Now, let us change the focus. Thank you, Harvinder ji. Now, let us change the focus and try to understand how the nursing councils and associations and government healthcare machinery is approaching this changing dynamics. To share government and council perspective, it is my pleasure to introduce a nurse leader from the Central Institute in the health machinery, Dr. Satyakani Thangaraj, who is here with us today to share with us as to how the government healthcare administration is dealing with the changes. And she also is a Florence Nightingale President Award recipient. Madam, over to you. Now, before I go, I would like to add on few areas where we would like to have your enlightenment. Soft skills play a big role in high pressure environments like OR. This is even more challenging in a premier government institution where you are working and with the patients from all sections and varying levels of healthcare understanding. Madam, how do you think communication, teamwork, and workplace culture impact nurses' performance? Are there any improvisations or new strategies that you have adopted to help reduce the burnout among the OR nurses? Dr. Satyakani ma'am, over to you, please.
Yes, ma'am. Good evening, everybody. Thank you for this opportunity. So as we come to this webinar, it's a smart OR with the lives with the people, the surgeons, the nurses, anesthetists, and the technicians who are bring skill, judgment, and compassion to single day. The focus of my brief remarks today is on human side of smart OR, the essential soft skill, teamwork, communication, and emotional intelligence that form the foundation of safe and effective surgical practice. Coming to the part of soft skill and team dynamics, in operating room, we have to be very firm with the people because we are dealing with the life and death of the patient. A successful surgery depends on whatever the work we are doing, what we talk there. Effective communication, mutual respect, situational awareness ensure that every member of the team functions part of the well-coordinated unit. For nurses, that means more than just following instructions. It means anticipating the surgeon's needs, ensuring patient safety, communicating concerns confidently, and bridging the gap between the disciplines. These are the soft skills, but in reality, they have hard impact on patient outcome. Some of the research shows that miscommunication and poor teamwork are major causes of perioperative errors. On the other hand, cohesive team that practices open communication can prevent the complication and reduces the delay and create a positive work culture. So we can embrace the smart technologies, smart communication and collaborations. Truly speaking, smart war is one where every voice is valued, every observation is respected, and every action is guided by shared purpose. Yes, coming to the next, the burnout and conflict and mental well-being of the nurses, those who are working in the OR. The operating room is a high-pressure environment where we have the time limited and the emotional loads are very invisible. Nurses in perioperative settings are particularly vulnerable to stress, fatigue, and burnout. Managing the emergencies, long hours, and emotionally demanding cases, we must acknowledge that the burnout doesn't just affect the individual well-being, but also the teamwork, decision-making, ultimately patient safety is a concern. It's not a personal weakness, but an occupational hazard. that deserves institutional attention, because most of the time, beyond the time the surgeons will ask for the cases. It's a teamwork. Actually, we need not to wait for the patients because the patients are fasting from 10 p.m. till the case is taken over to the OT. When they are demanding for the OT, we have to be more concerned about the patient also. And other hand, that is the surgeon's support also need to start the OT. So here it comes the conflict and the mental well-being of the nurses also more concern here. Conflict is the reality of OR practice. Different in hierarchy, communication breakdowns, and stress-induced reactions can affect the team climate. Learning managing skills, assertive communication, and emotional regulation helps maintain harmony and mutual respect even in tension situation. To support our teams, the hospital needs to cultivate an environment that promotes mental well-being through regular debriefing, peer support, and mentorship programs and mindfulness training. A simple act of checking in with the colleagues after a difficult case can make huge difference. As a nurse leader, we have responsibility to normalize the conversation around stress, emotion, and mental health, because caring for others with caring for ourselves and our teams. Yes, ma'am. This preparing students for the emotional realities of OR practice. When we teach the nursing students, we should have the perioperative care. We focus extensively on instruments, aseptic techniques, and the procedures. But equally important is preparing them for the emotion and interpersonal realities of the operation theatre. Students must learn how to manage anxiety before assisting their first surgery, how to respond under pressure, how to communicate respectively within the multidisciplinary teams, because surgeons will be there, nurses and the paramedics. So many people will have to adjust to the situation, and how to reflect on experience that are emotionally charged. Integrating simulation-based training for the students and extremely helpful for them. Scenario that combine clinical and emotional challenges, such as responding to a sudden complication or handling a tense team movement, allow students to practice both technical and interpersonal skills in a safe environment. As an educator, our goal should be to create emotionally intelligent professionals like nurses who are not only clinically competent but also empathetic and confident in complex interpersonal settings.
Thank you, ma'am. Thank you for giving that insight and throwing light. We understand that how many teams you have and how you are incorporating it, and assertiveness is definitely needed among nurses. Now, the responsibility of preparing young aspirant nurses and setting their expectations at the beginning of a career can be quite challenging. We've been handling it as academicians. To share an academician perspective, we have with us a veteran administrator and academician, Dr. Meena Ganpati, who herself is an experienced teacher and nurse leader. Madam Meena, you have been involved in preparing young aspiring nurses for a very long time. They depend on the nursing institutions to equip them with knowledge and skills required to build a career in the perioperative nursing. Can you throw light on how well does the current nursing curriculum align with the emerging technologies and evolving war trends? Does academia adequately prepare nursing students to adapt to the rapidly changing technology, work culture, and hospital SOPs? Over to you, Meena.
Yeah, thank you, ma'am. Good afternoon to one and all. We have an excellent team, lot of Florence Nightingale awardees and people from work area. And I think I'm the only academician in the crowd. And thank you very much to you, madam, and to Hxplain Digital Health Technology Solution for giving us this opportunity to be part of this panel. And the topic chosen is also very apt according to the need of the society. So once again, I thank you for this opportunity. And coming to your question, you have asked a very pertinent question about how well as academicians we are prepared to turn out nurses who will be able to work in the current situation. I think as I'm listening to others like Dolly Madam or Bipin, they are having difficulties working with nurses who are not clinically competent. So coming to our curriculum, whether it is aligned with the modern need of the OT, I would say the curriculum is aligned, yes and no. Coming to S part of it, how it is aligned is, recently Indian Nursing Council during the COVID time has revised our curriculum into semester system. And this is a credit-based program where the curriculum talks about, the beginning of the curriculum says that there are certain core abilities or core qualities that are competencies that a student nurse should develop at the completion of the course. So this starts with, there are 10 well-written quality indications or competencies which are in line with the global competencies. So this is in line with NLN, that is National League of Nursing. So if these competencies are developed in our nurses, they can work not only in India, they can work all over the world. So these competencies start like this. Number one, able to provide patient-centered care, should be well informed about health informatics and technology, able to communicate in every situation, teamwork, collaborate, provide safety for self as well as for the patients, and work on the quality improvement. And whatever care that they provide should be based on evidence-based practice. And whatever learning that they take in the graduation is not sufficient. It should be a lifelong learning. So these competencies, we call it as program outcome. So be it perioperative nursing or be it intensive care nursing, we as academicians take this 10 competencies and see to that the students are able to achieve all these competencies in every area. Like coming to OR, not only the basic foundation part of it they know, aseptic techniques they should be able to know, communication in terms of S-bar or S-bar you call it, and how to work with the team. Who are the team members? What are their roles and responsibility? Besides nursing roles, like besides being a circulating nurse or being a operating nurse. And quality improvements. What are the latest quality audits that are going on in operation theatre or in perioperative nursing, as well as evidence-based practice? Whatever students are taught is based on the latest 5 years of evidence. We take that, we accumulate, means in theory, we incorporate the latest evidences. And also we tell them that this is the beginning. As a student, you are getting an hand-on competencies about 60%. Then once you go into the area, you have to keep practicing. You have to keep shadowing the senior nurses. Coming to our theory part of it, as we put this into modules and teach them. So these 10 competencies are well sufficient enough for students to work in the area. Coming to our practical part of it, like earlier, like Madam Sharda and I come from a premier institute in South, where as soon as theory is given, we were put into practical area and we would start assisting, being in the operation theatre, start assisting minor cases and then to assist in major cases. That is not the case in the present scenario. Doctors or any health care facilities where our students are sent, they're not keen on students working on the area or working on the patients. So after teaching the theory, we take them to the simulation lab. So all the 10 aspects of our competencies are taught in the clinical area, starting with scrubbing, gloving, and what is the role of a circulating nurse or operating nurse, and what are the equipment for different surgeries, and how to prevent infection using, say, about latest bundle protocols, etc. We teach them in the clinical area by simulation, And then we take OSCE, we take examination, then transition them into the practical setup. By doing this, once they go to the clinical area, they are with the teachers and slowly exposed to the clinical or operation theater, they are able to compete or they are able to cope with the clinical situation. Coming to the challenges that as academicians, what we face, we are able to give the competency. Coming to college part of it, teaching part of it, it's like trying to teach a student or trying to teach any person to drive a car in a slow lane. Because in theoretical teaching, there should be a lot of confidence that is inculcated in the students. So when we teach them as driving in the slower lane. But when they are exposed to the clinical area, when they start working as a novice nurse, they are made to practice like a driver or drive in the fast lane. The situation is not like what is experienced in the college. The situation is more volatile, more difficult. The gap that our students face when they become novice nurses are, they have the competency up to 60%, but they are made to jump into 80 to 100% of competency and drive like a fast driver or a sports car driver. That becomes overwhelming for our students. So what I would expect, all as you all talked about, mentoring our newer nurses through simulation. This simulation part of it has to continue in the work area, and then a lot of hand-holding. Slowly, gradually allowing these nurses to get oriented to the OT for about 3 months. Then students will take up, or novice nurses will be really confident and comfortable to work in the clinical area without any hesitation. The solution is how Madam Dolly or Madam or Bipin, how you transition our nurses into operating nurses. It is in your hand by giving that 80 to 100% of competency. We come out with 60%, you'll have to work on the 40%. That is the only way where academic can be translated into practice. Thank you. I hope I have answered the. One more thing, as we teach also, we get into the policies. Those syllabus does not talk about policies like NABH policies or CDC policies or JCI policies, World Health Organization, WHO surgical care policies, etc. are not talked about in the syllabus. But when we teach any unit, we find out what are the latest policies applicable globally as well as locally. We incorporate it in the theory as well as practical for learning so that students are able to transition into the area. I hope I have answered the questions. Thank you.
That was well said, Dr. Meena. You have proved that you are a veteran in the academic area. As we come to the, summing up of the opening remarks given by all our stalwart experts, panelists, they said that automation is so high that TMP factor, that is time, money, material, and personal factor, has come to a cost effectiveness and cost analysis of the hospitals, as Bipin was pointing out. And as we were going through communication part of it, what Dolly was placing, she also said about patient safety and outcome, which has become a challenge because of the lapses in the communication, even to set right a small material, the maintenance of it, how important communication. I'm sure the participants, the new novice nurses who are hearing that, we've been talking, as Dr. Meena was rightly pointing out, that we have been teaching 60% of what is being spoke to you by the experts here. So the rest is for you to escalate it. And the well-being of the nurses, what Dr. Satyakani was talking, how it is very, very important that the well-being of nurses, because lot of pressures, lot of team, the work culture is so high, both Dolly, Bipin and Dr. Satyakani and also Madam Harvinder was pointing out. When that is there, then what is important is our emotional quotient as a nurse in the perioperative nursing area. Of course, from where you will get this emotional quotient, the CNEs that they are preparing, the standards, the SOPs, and the core competencies, what Dr. Meena was talking about, given by the NLN, all these things, and above all, the assertiveness, what we have learned, we carry on and carry on. So that is a very, very important message thrown by all our panelists here as to how to become a good perioperative nurse. Thank you for all of you for giving us that insightful opening remark. As we move on, before the second session starts, I request Ms. Vinuta Pinapala of the head of product of the Hxplain MedTech platform to give us the Hxplain, how it is all in a one-touch button in your mobile app. What madams were talking about, the standardized procedures and the modules, how it's going to help you as a perioperative nurse. Madam, Ms. Vinuta, it's over to you for Hxplain and the work, the courses that's being made in the developing the knowledge of the nurses. Over to you, Ms. Vinuta, please.
Thank you very much, Sharda ma'am. I hope you're all having great insights so far shared by our experts. In fact, you can look forward to more right after this announcement. So you'll have to bear with me for a little time. We take this opportunity to tell you a little bit more about Hxplain, our vision. We are a digital learning platform for healthcare professionals. Our mobile app-based platform, it helps to keep people stay up to date, refresh their knowledge, and build on their professional development with our vast curriculum and course content. Our learning content has over 40 courses covering clinical areas, specializations, behavioral and managerial skills. We have both an annual curriculum, which we tie up with hospitals, and we also have short course programs for individuals and hospitals. Just to give you a small flavor of our platform, here is a small demo. Now, getting started on our platform is very easy. You can download our app from the Play Store or App Store. Once inside, your personalized learning dashboard gives you access to your assigned courses and multiple learning utilities, all in one place. At the core of learning are the course modules that you as an individual have subscribed to or your hospital has subscribed to. Courses are broken down into a quick pre-assessment, short videos, games, and a post-assessment. Learning modules consist of short videos created by subject matter experts, keeping in mind the need of working professionals, and they are available in English and multiple Indian languages. Interactive games are weaved into the course to make learning more engaging, and it helps to remember what matters. The course is complete. Sorry. Give me a moment. I think there was a little move of the cursor there. You might have to bear with watching a few things all over again. So the course is complete once you pass the post-assessment quiz, which has a minimum qualifying score, and you can attempt it. Okay, there it goes again. You can attempt it multiple times until you get the passcode, because you can then strengthen your knowledge by re-watching and relearning the videos. To also tell you about the other utilities that we have Pocketbook, which allows for ready references, medication calculators, and a glossary for ready references to key terms and abbreviations. With the Hxplain digital learning platform, your learning and professional development is in your hands. Let's learn better. Let's care better.
Thank you, Ms. Vinuta, for bringing
Dr.
in
Sharda?
this. Yeah, thank you. Thank you, Vinuta. We have heard from you. And as you can hear from her, you can download it from the Play Store and do it. Hxplain is also there to tie up with the hospitals and give all these courses. Right now, they are working on more of gaming techniques and also on the instruments used in the theater. So that is our USB. And for all the delegates who are attending this, please look into that. Whatever the hospitals are doing, the payment is a third-party payment that Hxplain is doing. We know the value of nurses, and we would like to honor the nurses. Now, moving on to the second segment of the panel. In our segment, the buzzword is AI, artificial intelligence. So whether we have intelligence or not is redundant now. The question is, do you have AI in your hospital, in your college? So that's a buzzword today. And we know that our distinguished panelists are well acquainted with the advancements in AI, assessed its practical applications, and effectively distinguished its true potential from the surrounding hype. We eagerly await their insights during this session. As we move into a new era of smart wars, artificial intelligence is beginning to shape how surgeries are planned, monitored, and supported. Let's explore what this means for our nurses and from our panelists. Dr. Satyakani, can you share with us how the government institutions are viewing AI in perioperative care? Has there been any initiative to work with AI to assess the usefulness of it in Indian context? Madam Dr. Satyakani, over to you.
Thank you for this question, ma'am. The artificial intelligence is rapidly transforming perioperative care. So making surgeries and safer and move in different way. So workflow and work scheduling also the AI is used in different hospitals. In our organization, we have not yet started. Maybe they may be working on that. Yes, most of the AI is used in modern surgeries. So nurses, we are getting in the real-time alert, patient readiness, and the instrument availability, everything they are assisting through AI. And anesthesia and the monitoring, so drug flow. So most of the drug anesthetists giving, the nurses are working on that. So they are using in AIMS, New Delhi and Chennai Apollo. We are not using here as it, because we are most nurses are here more than the AI. We are working here. And also instrument and sterilization tracking. So most of the nurses, we are doing manually, doing what are the instrument counting, mop counting, gauze space counting, everything we are manually doing it. But when AI comes, they will take over, because we are saving the time and the patient safety, quality of care we can provide for that. and the predicting analytics. So for that also, this Tata Memorial and so highly sophisticated hospitals like in Narayana, they are using this AI system. Documentation and education, that is it's mainly for the student learning. They are moreover we are also wanted to learn many things from the AI. This may be the my side, but my side opinion, but AI cannot replace the nurses because we are the efficient more than the AI. Whatever our brain is made like that, we will be able to do till that thing. We the OR nurses are very smart in like AI. This is from my answer.
Thank you, madam. Thank you. It was on the lighter vein, but though you have touched the crux of this. So everyone is scared of AI, as you said, the myth behind it. Dolly, madam, you have been working with a leading corporate chain hospital, and your organization, do they engage with AI tools? What is the understanding among your nurses about AI? What are the common fears or myths and misconceptions that you find among your nurses? Of course, none of us are experts on AI, but we know that we have already stepped into the AI era, and we have to sooner or later, learn and relearn and unchange or change whatever we have learned. So, Dolly, madam, can you please throw light on how this AI is carrying a myth among our new novice nurses or the old nurses? Because I constantly hear nurses telling, oh, we are going to get replaced in theater, especially because robotics have come now. So they are scared probably. Over to you, Dolly.
Very true, ma'am. We know that AI, which is this is the AI era, and where AI is enhancing the precision in surgery. There is no doubt about it. The true navigations, it is helping the surgeon to understand where the anatomical mapping and, the resections of the tumor going into a very deep stage where very difficult to understand, where AI is helping the surgeon a lot. Similarly, yes, you are right that there are a lot of myth and misconceptions amongst the nurses are there, especially they think that AI coming in will cause job displacement. We may not be required, the amount of work that we were doing may not be required. We may have to displace from the OR area to another. So maybe that is causing fret or fear in the mind. Second is the nurses may think that it will lead to the AI coming in will lead to de-skilling, because if AI takes care of patients monitoring, documentations, auditing, and care, so that may cause de-skilling of the nurses. That is fearful. Even one article I was reading where it is written that you basically in the developed country, in India, yet we get the 100% advantage of AI, but in developed country already it is in process completely. So de-skilling is one of the fear. Job redundancy, that nurses are thinking that AI coming in will cause our job redundant. So that's actually a misconception, because ultimately AI needs to be operated, and where human being required. Without the human brain, it's not possible at all to run this AI, isn't it? To operate the AI. Though technologically we are becoming more and more advanced, but behind each advancement and technology, ultimately human being or human brains is needed. So these are the perception which are there amongst the nurses. And of course, nurse thinks that emotional, dependency maybe will be lacking. So AI will not be able to support the patient or care that is required by our patients, where the emotional connect with the high technology, high level of care, or the communications what is required with the patient we're dealing, that will be where AI will take away that. That is one of the fear is there. Over dependent on technology, with this AI coming in, over dependent on technology, will reduce the efficiency in the calculation of the drugs, calculation of the infusions, understanding the patient's overall status, because all will be depends on AI monitoring. If it causes any sort of glitches come, it will, whether the blame will come on nurses. So these kind of perceptions which are there amongst the nurses, and AI, the perception is it will make the AI will make dehumanization of care. So that needs to be taken care. So overall, if we say all this, maybe nurses are thinking, but these to some extent are a myth, because ultimately human touch will never go, whatever level of AI comes in. Nurse has to be empathetic, nurse has to be compassionate when at the bedside, when an allocated nurse at the bedside, even if a monitoring system are there, but still nurses play a great role of connecting and taking care of patients. And that culture needs to be inculcated in the clinical field, and that is a top-down culture. Top-down culture that is from the senior leadership. The culture has to grow, that how you talk to your patient, be polite, be empathetic, be compassionate. Patient may ask so many times questions. We have to have resilience, and we have to have patience to reply to them till their doubts gets clear. Which
well said, Dolly. Yeah, well said, well said. Dr. Meena, you predominantly work with the students. I'm sure you've been asked this question by your students. Madam, can you, will the AI replace us as we, grow in our career? Will it enhance the expertise or reduce the expertise? What Dolly Madam also was telling. Share us with your experiences and views on artificial intelligence. Over to you, Dr. Meena.
Muted now.
Madam.
Coming to my students, they are not afraid of AI, because being Generation Z or millennials, even my faculty, the younger faculty, they are not worried. They are not worried because it's created by human being. It cannot take over us. And medical field, including medicine, except maybe certain routine work like certain areas, AI can replace, but nursing AI cannot replace, because the human touch, only a human can give it to another human being. Nursing, the human touch or empathetic or 24/7 into 365 days profession cannot be taken by any machine. That part of it my students are very, very clear about. My students are also very well informed about all the areas that you talked about, like predictive analysis of identifying complication. As Bipin talked about, it has also reduced the time in which you identify complications and treat, identify infection, or routine work like manual rotations, etc., etc. Routine works, or which is repetitive works, can be taken by AI, but creative and critical thinking and the empathy that is needed for a human to deliver care to another human being cannot be given by AI. So that part of it, as a student, as a faculty in touch with the younger generation, I'm sure my students are not afraid. They know it is an added boon. It will enhance their care, but it is not going to take away their job, that they are very clear about.
Thank you, Meena. So to say that even to take the AI, you need a nurse.
Yes.
Now, now, what we are doing, AquaCheck is there to check your BP. All technology is there, even to use a smartwatch. But to teach that, you need a nurse who is well trained. Well said, Dr. Meena. Harvinder ji, how is the quality standards approaching AI in healthcare? What are the guidelines in preparing nurses for AI integration through training and adaptability as in the SOPs of the accreditation? Can you please throw on that? Unmute, madam. Madam, you are muted. You're muted, madam. Yeah, go ahead, madam. Yeah, go ahead.
Because I have to unmute.
Yeah.
Because I am hearing the all panelists very well said. The madam said that my students are very much confident that AI will not replace. That's fine. That AI will not replace the nurses. I also agree. Nobody can replace the nurses. But in India today, we are at the fascinating junction when it comes to the role of AI in healthcare, and that nature places the nurses right at the heart of the change. First, because why the AI has come. So AI, because any tool, whatever so come to the healthcare industry, because new researches are going on. So AI also is one of the tools which we are using in our healthcare sector. So it support us to do the better patient care, but it cannot replace us. It cannot replace us. As a human touch, Dolly said, the human touch cannot be replaced by any AI. So I totally agree with you. So role as a nurse is expanded from the purely bedside care to being a partner at the technology enabled care delivered. So many modules, so many models are coming. So the nurses should be, there are my 3 points. The nurses should be familiar with and they should be comfortable with the technology, and for that they have to learn that. Because when it comes to the healthcare industries, we have to adopt that. That doesn't mean that it is going to share our jobs, or it is going we will jobless. No, it is going to help us. So we have to learn about this, including the awareness of the how the data input we are doing, what kind of technologies is going on. Because nowadays students are coming with so many of technologies, it is around the environment, and they are very much learned also. So they learn the technology. And AI helps us also in critical thinking, decision making supports. It doesn't replace a nurse judgment, it augments. And the training modules should emphasize when they trust the AI output, and when to question it, how to interpret it, AI suggestions. So it may be not in the curriculum, it may be, but after the college, the nurses are going to the Dolly madam, to the Vipin, they are going for the job there. Now here the AI integration is there, some robotic surgeries are going on there. They have to learn that. If they won't learn that, they will be miles lag behind. So they have to learn this AI also, new technology. As Bipin said in her first answer, they are doing so much technologies coming to the healthcare industry. So they are here now. Before that, they were using the 50-60 blood bags. Now they are using only 12 or 13 blood bags only. So what is that? That's a technology only. So AI is somehow other how it is replacing. It is not replacing the nurses. So adaptability and workflow engineering is very important. That implementing AIs often means workflow change, shift timings, task allocations, communications, patterns. We need the nurses who are flexible, because nurses needs to be flexibility in their work also. If they are not flexible, they won't adapt the things. If we should not think like in previous era that we cannot adopt all these things. We have to when we have to go for these kind of new technology surgeries also. So in short, training alone isn't enough. We need ongoing mentorship. As Dolly said, our senior nurses, they are mentoring the junior nurses, and the peer learning also enhance these kind of things. So that means that upgrading education programs, establishing the hospitals, onboarding, and creating the culture. As you said, you are introducing these so many modules in the perioperative nursing. So nurses can learn those modules also. By learning these kind of modules, new nurses can learn so many things, and for the better patient care, and for the patient safety also. So I totally agree that nurses should adapt and learn and have a training along with that NABH accreditation training, along with all these kind of training, the nurses should learn the new technology also. So I totally agree with that, sir.
Well said, Harvinderji. Bipin, we are all discussing about smart ORs in various forums. We would like to hear from you because you yourself is in the smart OR. And how integral do you think artificial intelligence is there? That means smart OR. Artificial intelligence is equal to smart OR today, what the current buzzword is. So what is your take on that? Can we have a quick answer of that, please?
Yes, madam. Smart operating room powered by AI is intelligence represent the cutting edge of surgical environments by integrating AI technologies into the operating room. Healthcare facilities can enhance the efficiency, safety, and precision of surgery, not the replacement, as all panelists has said previously. So AI assisted surgical planning and decision making, it's make a difference. AI powered surgical robotics is also make difference. Intraoperative monitoring and support, as we see, if AI is alert us about the vitals and the blood loss and all the events during the surgery which are going, so that can be helpful and make a confident to make a backup plan. Okay, and advanced surgical, its AI is enhance the navigation also, surgical navigation. Surgical navigation we are usually using in the neurosurgery, brain surgeries, and all these kind of surgeries. So it's make precisions our decision and our planning. AI driven post operative monitoring and recovering is also make a difference. Yes. AI enable infection control and environment monitoring. How AI can be integrated into the OR, as madam said. I'm answering that question. Integration with exiting AI OR technologies. Okay, so our existing OR technologies, it's integrated by the AI. Collaboration with surgeon and healthcare teams. So it can also help us to collaboration with surgeon and healthcare team, like technician, nurse, anesthesiologist, technologist, and all this. Future direction for AIs in the smart OR, AI powered surgical assistance. Okay, as what's in previous, assistant is just to assist the surgeons and follow the command as per the surgeon. Okay, now in the you said that the AI assisted robots, the AI trained assistants have to fine adjustment of the robotic arms and all this. So these are the changes in our traditional surgical assistant and the AI trained assistants. Okay, the integration of AI into modular operation rooms has the potential to revolutionize surgical care by improving precision, reducing human error, enhancing safety, and streamlining workflows by providing AI-driven insights in surgical planning, real-time monitoring, and creates OR safer, more efficient environments and post-operative care. The smart OR creates a safer, more efficient environment for both patient and the surgical teams. The keys is to integrate AI with existing healthcare technologies and practice in the way of complement human expertise, enhance decision making, and ensure optimal patient's outcome.
Thank you, Bipin.
Yeah,
so,
thank you,
at the to sum up this artificial intelligence, behind every artificial intelligence, there should be an intelligent and dynamic nurse who is intelligent to operate it. And then only the patient safety outcomes will be achieved. So that is what I look at with. So now coming to the question and answer sessions, we have here a lot of buzzing questions from the audience. And to help us with the Q&A, we have with us Ms. Srilata Vasuraj, who comes with over 35 years of experience in OR as a nurse and in leadership positions. She has worked with some of the leading surgeons. Srilata also had the privilege of assisting Dr. Ross in Ross procedure. Srilata has collated the questions sent by our viewers during this session, and she will help us to get the responses by our panelists. Over to you, Ms. Sri Lata, all yours.
Thank you, Dr. Sharda. Good afternoon, everyone,
Good afternoon.
and wish you all a very happy Perioperative Nurses Week. The session has been an eye-opener for many of us, I'm sure. I just wish I was still a practicing nurse, and sessions like these are very useful for nurses to stay updated and makes learning a lot easier. We've been seeing a lot of enthusiastic participation, and the quality of questions is very good. It's both on AI as well as the practical, day-to-day work of the nurses. So my first question will be to Dr. Meena Ganapati. Ma'am, you had talked about, you teach the college students the basic foundation of OR and their roles and responsibilities. There's a question from Kumaran from Manipal, Guntur. Do nurses today have enough knowledge about AI, the working nurses? What should be their top priority to stay prepared as technology advances?
As I talked about earlier, madam, coming to the younger generation, that is of my present students, that is Generation Z, they are tech savvy.
Yes.
A chat GPT or a quick billboard, any kind of AI related equipments, agencies, students are in touch with. They are well versed with that. Coming to the earlier generation, maybe baby boomers or faculty like me who are in their 50s to 60, or maybe from 40 to 60, I would say, that generation have little hesitation to adopt to AI because little resistance for newer things. So what we have, so those kind of people, like people who are in the age group of maybe 40 to 60, we'll have to take an effort to learn AI. And this learning has to take place on day-to-day basis. And there should not be any hesitation sitting with the younger generation and learning this newer techniques. Where I think in a situation like that, everybody becomes a teacher. So I think nurses will have adequate knowledge when we are open to learn from our younger generation and attend to more workshops on AI, attend seminars. And in your own hospital, there is a simulation setup or simulation lab where they will have VR, that is virtual reality, operating theater techniques, etc. Be a part of it and go for interdisciplinary training of AI related robotic surgeries, etc. Wherever there is a possibility where AI is being mentioned, I think as nurses, we should take part in this, attend those seminars and webinars, etc., etc., and ask for a mock drill, interdisciplinary team when we are having a relaxed period where all of us can come together and have a mock drill about the surgery.
Very true. Yes, very true, ma'am.
Participate in quality audits, be open. So in older generation, if you are open, we will be able to have adequate knowledge about AI.
Okay.
Thank you, madam.
Thank you, ma'am. My next question is to Mr. Bipin. This is from Chennai only. How can OR nurses practice troubleshooting smart OR equipment during emergencies? That is something that they would, have a lot of trouble with.
Yeah, that's a nice question. I think the connectivity issue is there.
Carry on. We can hear you.
I think connectivity issue is there.
You are audible. Yeah, you're absolutely audible.
Yes.
Okay. Operating room nurse play a crucial role in the ensuring the smooth functioning of all smart OR equipments, especially during high pressure stimulation like emergency. Troubleshooting during the emergency require combination of knowledge, preparation, and calmness under the pressure. Here, how OR nurse can practice and effectively troubleshoot it. So understand the smart OR equipment. Okay. First and foremost, nurses should have comprehensive knowledge about the equipment they are working with. Okay. Modern smart OR often have integrated system that include surgical robots, camera monitors, visualization tool, anesthesia delivery system, electrosurgical devices. Okay. Patient positioning and the monitoring devices like X-ray, MRI integration. Lights and surgical table control system, gain familiarity with common issues, develop standard operating procedures, routine practices and mock drills. Okay, training with the simulation tools. Because of it is a simulation tools, it is a safer to direct. We are not using on the patient, so it is safer. Safety side also is it is useful to training with the simulation tools. Okay, regularly review technical manuals and quick guides. What happens sometimes the staff nurses are whatever they are receiving equipments. There are always, I had seen many staff members, the manual guides they are usually throw into the dustbin or throw into the somewhere else. So it is not a good practice. You just see the guide manual and read this. So many times you have aware with the equipment and the happening problems, occurring problems. You have a backup plan also you have with the reading that and study this the manual guide. Okay. So,
Okay.
yeah. So regularly review technical.
Yeah,
manual.
that's true. Absolutely agree with you, Mr. Bipin. So we're running short of time, so I'll ask
Yeah,
a
it's
few more
okay.
questions.
Yeah.
Dr. Harvinder Kaur, I would like to, there's a question on what strategies can improve collaboration and communication between doctors and nurses in the OR. Could you give us a little insight on that, please? What do you think is required for nurses to know?
Unmute, ma'am.
Yeah. Thank you very much for asking this question. In OR, the strategies we can use in collaboration with the nurses and doctor, first of all, there should be a good communication. Good communication and soft skill presentation should be there so that both of them will be comfortable with each other. Because sometimes when the surgeon is there in the operation theater, there are so many times attitude problems are there with the surgeons and with the nurses. Am I right, Bipin? If Bipin is
absolutely,
yeah, there are attitude problems. So when there are attitude problems, nurses may feel offended also sometimes. So they feel that they are neglected. So there should be a good atmosphere, and for that congenial atmosphere, they should sit together. Even before surgery and after surgery, debriefing should be there. Debriefing, after doing the debriefing, the surgeon can tell to the nurses that these things can happen in our operation theaters and it should not happen. If it is good, it is okay. That should appreciate to each other. So all team members should appreciate each other. If there is any problem, so they can be rectified after the every operation. So as madam said also, ki mass drills before doing nowadays transplantations are done. So many big surgeries are done, which to be held at the 7 hours, 8 hours surgery. So before doing that surgery, we should go for that drill and for that also, ki what are the requirements so that the surgeon should not have a panic attack during the surgery, because they should find everything in their hands while doing the surgery, and nurses should be a well equipped also. It is always a teamwork between the nurses and the doctors. They should be a companion with each other while doing the surgery, because it's a teamwork. So team building and Karam Yogi. Nowadays, the government of India has started the one program, Karam Yogi. So Karam Yogi program, these kind of things has to be taught to the each nurses, each doctors, at every level of the hospital, so that they can, these are the few strategies which we can use for the nurses and doctors to collaborate with each other, so that the atmosphere in the operation theater should be a very congenial, and for the patient safety, for the better patient care, we can use this. And moreover, the trainings and the debriefing and all these things. These are the very simple things which we can use, because Otherwise, there are a lot of things, but simple things can improve the atmosphere.
Thank you very much, ma'am, for that. One last question we just have time for that. For Dolly ma'am, it's a very basic question. Why are razors still used instead of clippers in many hospitals? And how can this be changed among all the hospitals?
Very true,
I have
madam.
also seen that.
Yes.
Clippers are always preferred over razor. And this is only happening still. Clippers are not used just because of ignorance. Clippers, the razors, which everybody knows, it is causing micro trauma to the skin. And that is one of the biggest issue for getting SSI, surgical site infection. So if this knowledge is there amongst the healthcare professionals, especially the perioperative nurses, the surgeon, doctor, and the senior leadership team of the organization, naturally, when the packages are done for the OR or different kinds of category of surgery, in the packages, the clipper will be introduced so that people will not think 100 times that, oh my God, clipper to be used, the cost will be there. Okay, so how can we mitigate the cost? How each clipper costs 750 rupees or 950 rupees. So initially when the package is created, the clipper has to be inbuilt in that. And if the knowledge is given by the infection control nurse, by the microbiologist, by the surgeon that no razor should be crossed, razor should be removed because it is one of the cause of surgical site infection.
Yes.
These need to be given. Then only we can prevent absolutely. And since last 15 years we are using clipper. In developed country, maybe before that. So, but in India, if still people are using razor, then
we can't do anything about it.
I have seen.
Yes.
That is why this question has come that
right.
using
Yes,
this.
what to do about it?
Otherwise, if they understand, they should read the data about this. SSI creates so much of cost on the hospital and in the patient. Than a clipper.
Absolutely.
Ma'am,
This is culture to be set in the organization.
Thank you very much, ma'am.
Thank you.
This is one last question for Mrs. Satyakani, ma'am. Ma'am, there was a question like, nurses, we need to, the patient attenders and the patients need, education. So who should educate the patient or the patient attenders regarding the surgery? Is it the nurses or is it the doctors? If it is nurses, then how should they, explain the risk and the benefits? How should they go about doing it without overstepping their responsibility and, that of the doctor?
Yes, ma'am. This is a good question. This attending the webinars and workshop that to focus on the latest advancement and technologies of healthcare. First thing, learning session help us stay updated with the rapid evolving medical tools and procedures. Surgical technology and practices change quickly, and continuous learning ensure us and remain as current, improving and our ability to deliver safe and effective patient care. Second thing, there is a value platform to bridge the gap between theory and practical skills. Workshop and often include demonstration and the hands-on training we have nowadays. Case discussion that help us apply knowledge to real-life situation, increasing our confidence in handling new equipments and techniques. Another thing, improved and teamwork and communication among multidisciplinary staff. Whatever we are learning, we are encouraging our subordinate, sharing and understanding of protocols and collaborating with them. So, which is essential for smooth workflow and patient safety in the operating room. Moreover, there is enhancing problem solving and adaptability. Facing technological challenges or unexpected scenarios become easier when we have the exposure to current innovation and strategies to manage them effectively. Another thing, there's attending the webinars and the workshops create opportunity for professional growth and networking. We gain fresh perspectives, exchange ideas with peers, and build a connection with supportive ongoing development and support in our demanding work environment. Engaging in continuous professional education on healthcare innovation not only improve our technical skill, but also strengthen our teamwork, communication, and readiness to provide high quality patient care in a smart, evolving, that is operating room. So this is my answer from this question, ma'am.
Thank you very much, ma'am. Thank you very much. I thank all of you all for joining us today. And over to you, ma'am, Sharda ma'am.
Dear panelists, it was indeed a great honor and privilege to have you all here. To sum up, I'm sure the delegates would have taken the key takeaways of how the smart ORs and what is the knowledge required and how they have to update. Definitely, they would have got that input right away from this webinar. And also Hxplain modules will help them. Now that they learned it, how to use it in the Play Store, through the Play Store, they can definitely take that and use it. And we here from Hxplain team, we would like to, though we are miles away, we would like to present you a wonderful memento. The hearts are very close. So please take the this wonderful memento which we has been parceled to you, sent it to you through courier to all of you. Kindly open that. It is a tortoise, our logo, and you can have that. It's a very simple and humble memento that we have shared from Hxplain team. And we are very, very glad, and we hope we will have many more such webinars. Thank you once again from my bottom of my heart. Thanks a lot for that wonderful session.
Thank you.
Thank you.
Yeah, thank you very much.
Thank you, everybody. Thank you.
Thank you all.
Namaste
Thank
all
you
of
so
you.
much, Shada ma'am, Dolly ma'am, then Meena ma'am,
Thank you.
and Satya ma'am.
Thank you, everyone.
Thank you. Meena madam, Satyakali madam, Dolly madam, Harinda madam, namaste.
Thank you, sir. Thank you.
Thank
you.
you.
Thank you.
Thank you. God bless all. Thank you.
Thank you.
We can log off now. We can log off.
Please. Yeah, please.
Yeah.
I know you are
Yeah.
busy with the meeting. I know.
Okay.
Thank you. Thank you. Thank you, dear delegates also. Thank you so much.